Thank you, and thanks for those that have come back after the break. As Paul said, I work for the Deloitte's UK Centre for Health Solutions, which is a small research hub looking at the challenges facing healthcare and life sciences industries and trying to work with people like yourselves to identify some of the solutions. I think of myself often and wonder what I have to say to you that you don't already know. And in a way, I feel what the research pieces that we do help to do is to sort of hold up a mirror to the industry about how it's being perceived by the different stakeholders and trying to bring those stakeholders together. There are a number of the reports that we've published are up there on the screen, but largely what I think is happening in all of the areas we look at is the power of technology. The developments that we're seeing, the innovation that we're seeing in digital is really changing the relationships, both within the different stakeholders' own sort of activities, but also in the way that they interact and work with each other. You know all this, that the healthcare systems in most countries are facing challenges and that they're under increasing pressure, and that the converging trends that we're seeing in all developed countries and in a lot of developing countries mean that they're facing the escalating healthcare costs, the increasing complexity of care, the change in patient expectations, and we heard that so eloquently from Ros this morning, but also from Molly yesterday. I shared at dinner. I was at the same table as her at dinner last night and got a chance to really discuss some of the challenges she's faced and be so totally blown away by how she's overcome many of those challenges. And for me, as I say, in all of the reports I've written over the last few years, the evidence for the use that tech can be put to, and how, particularly if you look at the challenges facing our own NHS with that deficit that is currently being estimated at around £22 billion, and yet 2.5 years into the 5-year forward view, we're still having reports of hospitals being significantly in deficit, new ones going into special measures. So how are they going to meet that change? And for me, really, and we see it in the 5-year forward view, we see it in other documents coming out of the centre, that technology has to be a really important part of the solution. So all of you who are working in this space are really well placed to suddenly have that place at the table, where for too long it's been a challenge. That doesn't mean it isn't challenging, and I'll come to that, but I think we're at a tipping point. I do believe that things are changing, and changing very quickly. Part of it is because the technology is advanced so much, and because it's so much more intuitive that people don't need to understand it and are less afraid of using it. But also, we can't forget the change that was brought about by the smartphone, and the fact that, as I say there, 50% of the world's population don't have access to the very basic healthcare, but they do, predominantly. I think the last count was 86% of people in developing countries have a smartphone, and therefore they can connect to and get the advice they need on healthcare that has been denied for so long. So I'm just going to talk about 4 predictions that we made back at the end of 2014 in relation to healthcare of what we thought 2020 would look like. And I'll leave it to yourselves to decide how much progress you think has been made. But I talk about the prediction, and then I talk about what I see is happening in the UK today. And in some of the predictions, we're much further advanced than we thought we might have been when we looked at it at the end of 2014. I mean, in others, we're still far behind. And this first one, if I was talking about this 6 months or so ago, it was very hard-pressed to find really good examples in the UK, of patients becoming more like consumers, of having a more confident and proactive response to their own health, of co-creating, as we heard from Ros. So that's why I think it is very, very quickly moving. Most of the evidence for our patients becoming more like consumers came from the US, where the consumer-led system has been operating for many years. And as a result, they have been much, much quicker to embrace technology, both within healthcare providers, but also patients themselves buying it, often because it's cheaper for them to actually buy it themselves than it is to engage with the healthcare system. But here in the UK, we still, and largely do for a lot of the public, have much more of the paternalistic approach to healthcare. I see it changing. It's changing quickly for our younger generations. It's changing quickly for those who are tech savvy, but we still have a long way to go to support our older generations, but also those that aren't digitally enabled to actually embrace and benefit from these changes. But some of the facts and figures around today, we've heard about the 100,000 Genome Project. What that is doing is not only helping those people with rare diseases and helping their clinicians to understand better the treatments, but it's actually helping all of us to understand that actually they are very, very different illnesses, and we respond very differently to the same types of genetics, to the same types of environmental stimulus. And therefore, we do need better information about ourselves. And having that better information also means that when a doctor tells you that this particular blockbuster drug will work, you can question it because you know from all the research and from the evidence that actually it might only work in 50% of the population, and you might be that 50%. So you can question more and understand more about how you will respond to therapies and actually what you can do for yourself. As we've heard this morning, it may not be that you need a therapy, a drug to help you address your health problem. It may be something much more simple. It may be your diet. It may be exercise. It may be the fact that you're living in a house that has damp, and it's the damp that you're responding to. So all those things are really important. But we're seeing increasing numbers of people comfortable using things like video and Skype, emailing their doctors, talking remotely rather than needing to see them face to face. And then you see the proliferation of digital doctor companies. I've got Babylon as the example here, largely because of its large number of subscribers, but there are a number of others, and we only heard this week that there are 60 digital providers registered with the CQC, and they will start inspecting them next year, which will bring a host of other issues and challenges. Healthcare delivery systems in 2020, with healthcare, the home being the place where most of the healthcare takes place. But then we already know that. And I'm talking about healthcare here, but health and social care for many people are very inextricably linked, I think is the word I'm looking for, and particularly the more dependent and the more vulnerable people. And support in one or lack of support in one leads to a problem in the other. So home being where you will receive that support, where you're connected home, providing you with security and providing, importantly, your family with confidence that you are well and being looked after. You can, for everything from chemotherapy through to warfarin being administered at home. And as we heard from Ros, your interaction with the actual formal healthcare system being in matters of hours or days rather than not the 24/7 that you yourself live with the conditions. So home monitoring, most of the examples at the moment are around things like COPD and diabetes, but increasing numbers of conditions are being able to be monitored at home. And one of the big barriers, of course, is access to health information and access to the patient's record. With some of the new vanguards and the vertical integration of healthcare and the horizontal integration between health and social care, that is opening up the potential to escalate and speed up this prediction so that people can have access and be treated more where they need to be treated and understand what's happening where they are rather than having to go and visit a hospital or a doctor or a GP. The market for this is increasing significantly. There are lots of forecasts around about what home monitoring will be like in the future. I think one thing is for sure, although there are different figures being bandied around, it is a growing market. But what we're also seeing is new partnerships, new joint ventures between providers. We've heard a brief mention of life sciences today. I wasn't here yesterday, so I don't know how much that they featured. But actually, the people driving some of these innovations are the big pharma companies, medical technology companies, partnering with the technology companies to produce new solutions to today's problems. And so those partnerships and joint ventures really are starting to transform what we think of as the health ecosystem. There are obviously an increase in hospital-to-home services. Some of the biggest challenges facing our hospitals is getting patients discharged safely. Hospital-to-home supports that, helps that happen, but more importantly, it stops people being readmitted if you can monitor them safely remotely. And also avoid the admission in the first place. And then the direct consumer models. People do want to take responsibility for their own health. People are prepared to invest in technology that will help them improve their own health and well-being. And that direct consumer model is very active and will only grow. And that includes everything from medication adherence and online prescriptions to actually getting early diagnosis through your smartphone apps. And then there are new provider models entering who are disrupting the system. In the US, you've got Walmart with primary care centers in their stores, which are undercutting the cost of traditional healthcare provision and are becoming one of the biggest healthcare providers in the US. It didn't quite work here yet when it was tried by Sainsbury's, but part of the reason for that is, of course, we expect healthcare to be free at the point of need, so that's one of the challenges. Wearables and mHealth applications, you know better than me all about this, but one of the barriers has been the fact that they were expensive, that they were obtrusive, so that people didn't like to wear things that indicated that they were needing to monitor their own health. And we see from the exhibition that there are technologies that and the wearables are very fashionable and are things that we can use and trust in a way that we couldn't only a few years ago. But every day there are more smartphones. Let's say every day there are 3 times as many smartphones are sold than babies born. So it's a hugely proliferating area. And of course, the number of apps. I've already heard today the 165,000 health apps that are in the Apple Store. That was at Christmas last year. I suspect there's a lot more now. But many of them, people don't know how good they are. They don't use them after they've downloaded them. They use them for a few times. And we do need that support and that health app library that NHS Choices did start to have, but then it took it down when there were some problems over security of the apps themselves. But others are stepping into that. There's a European health app library that has patients and patient groups putting in their views about the technology that's out there and supporting each other in the way that Ros described to decide what works for them and what's best for their condition. So it is happening, but there is more security about and confidence needs to be built for people to use them. And of course, there are the different levels of data. A lot of the apps out there are very one-dimensional, and what we want is very interactive and interoperable apps. And all of this is leading to big data. There is so much data, healthcare data is pervasive, but whether we turn that into information and insight is still a challenge. And that's really where the advances need to be made next. Health analytics, actuarial input into health and understanding population health dynamics are all really important issues. And we don't yet have sufficient skills in these areas. And that's an area that we see lots of initiatives to try and develop that. But we've mentioned the genome market, that's growing, people's understanding, and even if you're not part of the 100,000 Genome Project, because you're not in that category of rare diseases, etc., you can send off your own tests with 23andMe and other online and accessible systems so that you can find out at least a little bit about your own genetic makeup. But clinicians are the ones that need to be convinced. And so whilst that there is a lot of data out there, turning that into evidence and information that will convince clinicians of the benefits and value of this technology and the importance of technology-enabled care is really the step that needs to be taken now. There are always leaders. We need to reduce the number of laggards. Everywhere you look, everything you look at, you'll find someone somewhere doing it really, really well. And the academic health science networks are there to try and increase that uptake of innovation, which has to be a really positive thing, but we do need to see that done more at scale. You've got things like IBM Watson, who are partnering with all of the different stakeholders I've already mentioned and bringing together diagnostics on top of the information developed from all of both the formal and informal data. And the potential for all that is significant. But there are barriers. This slide was put together almost 18 months ago, and we're still waiting for the final output from the European Commission. But it's very difficult. People are very concerned about the barriers, no more so than clinicians and healthcare providers. Concerned about the lack of data protection, concerns over patient safety, quality and liability. Who is liable if something goes wrong when an app or some other digital information was acted upon rather than a face-to-face? Now, you could say, how do we know the accuracy of data that's provided face-to-face? But even so, there are concerns about quality and liability. There's limited cost-effectiveness evidence. Even though there is evidence of inputs, outputs, and sometimes outcomes, actually the cost-effectiveness data is not there. And given the way that funding flows in our healthcare system, that cost-effectiveness data is really important. There's also the lack of interoperability still, but that's improving, and inadequate funding or reimbursement models, and I'll come to that in a moment on my next slide. But cultural resistance still remains one of the biggest barriers, but things are happening to address that. Some of the initiatives that we have heard about here are starting to tackle these barriers. And no more so than the innovation and technology tariff that was mentioned just earlier, aiming to remove some of those barriers, some of the need for those local price negotiations that are very frustrating, particularly to small businesses when they have to negotiate separately with every single CCG or local authority. But in these cases, having a tariff should help. But of course, the proof will be in the testing. And then those are just some of the examples that you've already heard about where are already being recommended for use under this tariff. But you still do have the traditional cultural resistance of healthcare professionals who aren't convinced that the data is secure, whether the patients actually want the support in this way, and the evidence for using it. All of this has led to connected patients. We've heard about the traditional paternalistic model being no more. I think it's still there for a lot of people, but it's changing. And the empowered patient, the co-producer of their own healthcare, is starting to really emerge as a force, and a force for good. 75% of the UK population do go online for health information. A lot more are going on online communities and talking to like-minded people or joining communities of like-minded people with similar conditions or similar challenges to share, and there's power in that development. Connected providers. A lot of what we've talked about is actually empowering patients and improving the support that is given to patients. Providers themselves will benefit from this technology revolution. They can work much more smartly, they can work more efficiently, and that's what we need if we are going to overcome that funding deficit. GP practices, as we've heard, have led the way because they digitized their records some time ago. But you also see now, Airedale is a classic example. It was chosen as one of the vanguards. It's expanding its activities. But I still find it quite interesting that 2 years on, if you look for examples of where you've got real technology-enabled care going into care homes, for example, Airedale is one of the leaders. There are others now. There are 6 vanguards who are working to bring digital and better support, healthcare support into care homes, but Airedale still is a leader in this, and despite being able to demonstrate a couple of years ago the benefits that it was delivering. Then there are the home care providers who can use the technology to be more efficient, to increase the face-to-face time, to increase the number of patients that they'll see a day, and to reduce the amount of paperwork, which I'm sure is a relief to many. And then I've already talked about supporting care at home. We're still not as developed or at scale as we see happening across a number of US hospital groups, where you've got large numbers of hospitals being brought together, linked through an interoperable electronic patient record, linked through digital technology, so that you can monitor patients in 40 or 50 different intensive care units through one hub, and target exactly as people start to deteriorate, rather than when all the alarms go off in the actual ICU. And these things are transforming not just the care for patients and the outcomes, but also the cost of providing that care. And then we've got examples in those 10 hospitals that have been selected of where they have digitized a lot of their activities. I'll just leave you with this final slide about where I see the future developments happening. You'll be familiar with the Apple Health Kit, Google Fit, Microsoft Health Vault, all these things that have come. Some of them don't stay for long. Patients Like Me, a very powerful online community. We heard about Patients Know Best with the interoperable platform, who are transforming patients' access to their own health records. So those are solutions that are helping to integrate health and fitness data. Then you've got the digital technologies and the diagnostics, which are improving as a result of the partnerships that I've mentioned already, but also things like Google's DeepMinds and some of the innovation that they're investing in for smart pills that actually can read what's happening inside people's bodies, as well as transmitting that information to the diagnostics. IBM Watson's partnering with all of the big pharma companies, as I've mentioned, and developing innovation that will benefit all of us in the end. And one of the things that this is doing is breaking down those geographical barriers as well, so that I haven't mentioned here one of the predictions in our report, but reverse innovation, the innovation that's happening in developing countries, where they're able to leapfrog what we're able to do just because of the fact that there wasn't an infrastructure, and they've now gone for the digital infrastructure. You're seeing Singapore hoping to become the biggest, most digitally enabled healthcare system. You've already got Israel, who's very well advanced in that respect. So we can learn lessons from lots of different countries, as well as the ones we've already heard about today. And then pharma themselves, their business model is changing, their commercial model needs to change, and their interaction and understanding of how patients respond to their medication is becoming a really important part of their future development. Digital technology can help with clinical trials, it can help with online prescribing, telemonitoring, all of these things, and I think the time is here, that we're at the tipping point. And I've seen a lot of changes in the last 2 years, and all those changes are just escalating. So it's an exciting time to be part of it, and ultimately the benefits are the people like us, but also our fellow people living in our communities. Thank you.